Hi, how are you everyone? So I am just trying how to be a YouTuber or making content, earning money, I don't know. Please, this is a journey of pulmonary fibrosis. There are some that I didn't share that much for privacy. And by the way, these are important things that my pulmonary fibrosis husband used every day. Oh my god, it's a bilbil. So, it's a pulse oximeter. I'm sorry, I'm going to speak or try to speak in English kasi nga this is international. Some of my viewers came from other country. Pulse oximeter, this is a cheaper one, so I regret for using this one, maybe 3 months. And this one is worth it because it's not really expensive, but it's a high quality. In med, I know it's a high quality than this, and I always have pulse oximeter check. And a pulmonary fibrosis patient always have their breath mint. Sometimes we use the Mentos. Thank you so much also to the Mentos company and Snow Beer, because this is not just an ordinary candy, but this helps breath cool, because fibrosis patient is usually like having a hard time to breath. Look, that's why I have a pulse oximeter check, and he coughed a lot. The doctor prescribed our butamirate citrate or Senecod 14, a leading brand by GSK company. And it was 3 times a day or twice a day. I forgot. I think 3 times. This is for hard cough, dry cough. And I am going to be mindful to have a thermometer. That is because just in case he's having a fever. But ever since he was diagnosed, never naka-fever. I'm afraid because the doctor told me about septic urinary tract infection, which sometimes a patient has um, fever. And normally, or I do not know, please comment down below if you have a dry skin. That is because my husband always had a dry skin. That's why we use Jergens. The doctor prescribed. It's aloe vera. But I feel his skin is dehydrated. I always put, including his legs. And as a pharmacy assistant myself, I worked before. I always have my Isordel 5 milligram. It's supposed to be prescribed by doctors. It's an emergency pill wherein you're going to put sublingual, just like a heart attack occur. You're going to give, but I'm not recommending this one. I will be in jail. This is prescriptional, but I wasn't able to use. And this one, Doloneurobion, it's a kind of a pain because there is paracetamol in this inside. But if you are allergic to paracetamol, do not use this one. The main purpose of Doloneurobion or Doloneurobion, it has a vitamin B complex, because when when pulmonary fibrosis getting worse has, I'm sorry about my English, I'm just trying to getting worse, they're feeling numb, and also the, what do you call that, they're not going to notice that their hands are moving, their nerves are moving by itself. It's unstoppable. It was like that. I don't know. So the main content of Doloneurobion, it has B1, B2, B6, and B12. And I had salbutamol because he had a cough. Usually, those fibrosis patient started with asthma and then COPD because my husband also was, I don't know, when he was teenagers, his adoptive parents broke up, and he grew up as a Christian, and that's the time he was being backslide, so he was led astray and he became abusive to his body, and he asked forgiveness to the Lord because he was smoking. And then I don't know, maybe it's a man habitual, or it's normal to the to being man. And I have here this is prescriptional Norgesic Forte, but you can use a mild one, Norgesic plain. The milligram would be 35/450. It has a pain reliever just in case the head is very painful. And also, he has his allergic rhinitis. So, this Zicast, it has levocetirizine and montelukast because he was asthmatic and allergic rhinitis that reoccurring. So this one can help. It's once at night for 7 days. Prescription is very important. And we used this one before, a mild salbutamol for nebulize a smoke, and you are going to using the nebulizer machine. However, when we go to the hospital, the doctor told me to stop that one and replace into a puff inhaler. Symbicort Raffihaler is the name or the brand. And when we sometimes, if you are going to use this one, the one that has budesonide, something like an additional component in it, but usually we have the Raffihaler Symbicort. And in addition to, I have another B complex, which is Neurobion or Neurobion, and he's having a hard time to poop. That's why we had laxative. It's Dulcolax, the brand. And sometimes, because I was trying to save money, we had the BioFit tea. That's nighttime because avoid eating after drinking this one. So what else I'm going to share? There are asthma or bronchodilator medication which the doctor instructed me to cut. So it's 400 milligrams, so I have a tablet cutter. I'm going to place it in here so that you will cut properly the medicine. And I think that would be all. Cornflakes or the cereal, his favorite. I love my Baba. I love you so much and I miss you.